Well, 5 on your health this morning. Screening tests that save lives. They are designed to catch problems early, making them easier to treat.
But which tests should women schedule and when? Here with advice is Dr. Lydia Pace, a specialist in women's health at Mass General Brigham. Doctor, thank you so much for making time for us this morning. You treat women of all ages. Does one group qualify for more screening than the others?
Thank you so much for having me. Yes, there are many wonderful things that happen in middle age, but we also our risk of developing cancer or cardiovascular disease, unfortunately, really increases pretty dramatically as we age. And so once women hit their 40s, we all get asked to do a lot more screening tests. Most women in their 40s start having regular mammograms. At 45, all of us should be screened for colorectal cancer. For women who have a history of smoking, we don't talk about this enough, but many women with a history of smoking should receive an annual chest CT to screen for lung cancer. And during all of middle age, all of us should be having regular cervical cancer screening as well. And then I also want to mention, in addition to cancer, cardiovascular disease is the leading killer of women. And so all of us should have regular screenings for cardiovascular disease as well, so that we can catch it really early. And so getting regular tests of our blood sugar, our blood pressure, and our cholesterol too.
Good to have those baselines also in case there's something pops up later. So does that mean women in their 20s have nothing to worry about?
No, unfortunately. Women in their 20s, of course, have many health concerns, and it's really important for women in their 20s to initiate cervical cancer screening, which is typically increasingly done with testing for HPV or human papillomavirus. Women who are sexually active in their 20s also need regular testing for sexually transmitted infections. And I think your 20s is a really good time to establish a foundation for long-term cardiovascular and mental health. And I really encourage my patients in their 20s to get enough sleep, to get exercise, to establish good eating patterns as well. And we do some initial screens for cardiovascular disease at that time.
Also important. As you know, there is some debate about when mammograms should start and whether women should get them annually or every other year, maybe some people say. What do you recommend?
The reason that there is so much debate about mammography screening is that it is much more beneficial for women who are at higher risk developing breast cancer compared to women who are lower risk. So a woman who is higher risk is more likely to have her life saved through a mammogram. And women in their 40s are at lower risk than women in their 50s, their 60s, and even in their early 70s at developing or dying from breast cancer. And so they do experience less benefit from mammography screening. And so that's really why guidelines have kind of waffled about this age group. Women who are at higher risk because of a family history also will have more benefit from a mammogram. And so it's really important to talk to your doctor about risk factors you may have, such as a family history. The harms of mammography screening. So the reason that we're trying not to screen everyone all the time is that, as many of us know, mammography can be associated with what we call false positives, or having an abnormal mammogram, being told to come back, sometimes even having a biopsy, but having those tests not ultimately lead to a cancer diagnosis. And that can cause stress. It takes up a lot of time, and it can be a negative experience for patients. Mammography can also detect cancers and subject a woman to a cancer diagnosis and treatment when that cancer never would have caused her problems. But mammography it's the best test we have, and it can save lives, particularly for women at higher risk. So I do typically recommend that women start in their 40s. If they are at higher risk, I do screen them every year instead of every other year. But I try to have what we call shared decision making. I try to have conversations with my patients about those benefits and the potential downsides as well.
Oh, thank you for actually acknowledging all the anxiety that does come with those tests. So thank you, Dr. Lydia Pace, women's health specialist with Mass General Brigham. Have a great weekend.
Thank you for having me. You too.